What's up, you guys? It's just me, and I just wanted to get on here and talk about what is getting ready to happen. Today marks the first day of me starting my virtual clerkships for medical school. So, of course, we all know that we've been affected by COVID-19. We've all been quarantined, or at least we're supposed to be staying at home quarantine. But we've all been quarantined. Everything kind of has stopped. And so since that has happened, my school, St. George's University, and all other schools that I know about here in the US, even outside the US, they have basically pulled their students out of their clinical rotations and even stopped classes and all of that. So most people are going, if not all, going to online teaching and virtual clinicals, which we will have, I'm thinking, computerized patients maybe, but I'm not really sure. But nevertheless, I just wanted to come and say, talk about the fact that we are starting a virtual clerkship today. And basically we're gonna start off from where we left. So my last rotation was surgery. I only had around 3 weeks left of that before going into internal medicine. So I will be starting internal medicine rotation today via Zoom meeting virtual. And meeting with other students and attendings and things of that nature through this virtual way. So other students that were in different rotations, of course, they will be starting what OB-GYN, some will be doing psychiatry, family medicine, pediatrics, and so forth. So basically it just goes based off of where you left. They do have a curriculum that they've provided for us, and we must follow the guidelines that they have provided for us, so we will be able to get our credit and be able to graduate. And that is very scary because honestly, it was kind of chaotic getting the information, and then a lot of things were not clear. And everybody has their way of how they study and retain things. And while I'm was not in regular clinicals and I'm home, my way of studying, I basically do flashcards throughout the day. I do UWorld questions, at least 10 to 25 a day I try to do and review them. I also use my USMLE Step 2 CK book. That has definitely come in handy when I'm trying to understand a certain aspect of medicine that I'm focusing on. And sometimes when I'm doing the flashcards, it's kind of a fragmented way of studying, and I need to have a whole picture, so that helps bring things together. But now, since we have the virtual clerkship, they have structured out what they want us to do. So we have to use online med ed, which I was using that too, and I try to go through that, but it's not something that you have to do. But they're making it like a mandatory thing where you have to at least do 2 videos a day of online med ed. You have to do your flashcards on Firecracker, which is another study app that they provide for us. So we have to do that. We have to read articles, which, we were doing that anyway. At least some of us was reading articles and just trying to stay up on what's going on in medicine. But now you have to do that, and that's more of your independent study. You also have to do UWorld, and then you have to log all the things that you're doing, and this is the way that they're gonna kind of keep track of what we were doing. And that will be our, grade at the end. And it is a PassFail, so if you don't do your log every day and if it's not complete, then I was told by the Office of Dean that if it's not complete and it's not what they're asking, then you may not be able to get the credit. So it's very important that you dot your I's and cross your T's when it comes to this, because they're trying to provide us a way to be able to continue our education and graduate. So we have to follow and be compliant, because it's very hard for them to monitor what is going on, so we have to just make sure that we follow what they're saying so we can graduate. But anyway, I'm excited to start. It's definitely going to be different. I'm such a hands-on person, and to have everything virtual now is definitely different, and it's causing me to have to try to learn things a different way, which is fine. I mean, we need to be able to adapt, so it's fine. but it's just different. Even my board exam that's coming up that I was scheduled for, that right now it's still scheduled, but they have canceled basically all the board exams for my USMLE Step 2 CS, which is one that we go and have patient interaction. They have basically canceled that up until I think July 1. And mine was actually scheduled for, I want to say, I don't even remember, but I think it was like the 10th or 11th, something like that. But I think it may get canceled. I'm not very sure, but either way, it's going to be virtual. So I'm kind of like, I don't know. Now, our school has given us access to what they call iHuman, which is a computer program that basically allows you to practice on virtual patients that have different ailments that you need to be able to, take a history and get a diagnosis with, 3 differentials and write up a note and all these things. But it is not timed. You kind of do it, at your own pace, which you need to time yourself, I find, because when I do it at my own pace, it definitely takes me more than the 15 minutes, because you get 15 minutes to do an HPI and then you get 10 minutes to write your note. Using this program, I've definitely gone well over the time. So I think I'm going to start trying to time myself doing that just to get faster and more efficient with it. It's kind of hard though, because they give you a template and you have to follow the template, and following the template, I can't ask the questions in the way that I want to ask the questions. So that's what really slows me down. But I'm thankful to have that access. So, they have definitely provided a lot of resources for us, and I'm definitely thankful. So anyway, I will let you guys know how things go. I'll come back and update you guys. But yeah, virtual clerkships is what we are doing now. And, if you are in medical school and you are doing virtual clerkships, let me know down below how it's going for you. What's wrong? No crying. My son is kind of sad. Sit right there. I'll be right there. Let me know how it's going for you. Put it down below in the comment section. And if you found this video helpful, please don't forget to like and subscribe and also share. And yeah, I will talk to you guys later. Bye.